Hi, I'm Badr, a resident doctor and a graduate at the University of Southampton. Now, medicine is a huge field with thousands of students across the world applying to study at a uni every single year. But what jobs are actually available to you as a doctor? In this video, we'll look at the different areas you might work in medicine. As a resident doctor, you'll have the chance to practice working with different areas of the body and medical issues to help you decide what to specialise in. Think of medicine as a ladder. You start by going to medical school for at least 4 or 5 years, and then you embark on general training before narrowing your focus. I've been a doctor for about a year now, so picking a specialty route is a year away, and I've had the chance to explore different fields along the way. Early patient contact is a key feature of the course at Southampton Medical School, so I've been seeing real patients from very early in my training. Now let's take a closer look at some of the specialisms you might go into. First up, we have general practice. A general practitioner, a GP, or a family doctor is the first person you see if you feel unwell. They're the gateway to the NHS. They carry out exams, make diagnoses, and prescribe medicines, and also give injections. Internal medicine. Internal medicine is about preventing, diagnosing, and treating disorders of organs or other tissues. So cardiologists treat diseases of the heart, gastroenterologists treat diseases of the digestive system, and dermatologists treat diseases of the skin. Next, we have psychiatry. Psychiatrists diagnose and treat mental illnesses and conditions using a mix of medication and talking therapies. That could be things like depression, anxiety, phobias, and dementia. At the University of Southampton, you get the chance to join a placement where you regularly visit someone who has dementia, so you can witness firsthand their lived experience and reflect on how valuable it is to spend time with them as individuals. Surgeons treat conditions by operating on the body, whether that's repairing bones, removing tumours, or transplanting organs. If you're fascinated by the brain and the nervous system, you might become a neurosurgeon. Or, if you love sports, you could look into becoming an orthopedic surgeon. Well, you'll repair bones, muscles, and joints, helping athletes get back on their feet. Patients. You can choose to specialise in paediatric care, where you work with children. Geriatric care, where you work with the elderly. Or general care, where you work with people of all ages. When working with children, you need plenty of patience. They may struggle to explain how they're feeling and sometimes might be scared of medical procedures. On top of that, their parents or guardians might be anxious as well. Being kind, approachable, and a great communicator is key to helping both the child and their family to feel at ease. Unfortunately, many elderly patients experience loneliness, and sometimes doctor's appointments become a chance for them to talk about more than just their health. While it's important to listen and provide support, you also have to manage your time well to keep your appointments running smoothly. You'll also face more end-of-life care and bereavements in this field, which can be emotionally challenging, but incredibly meaningful. Private and public healthcare. The main difference between private and public healthcare is who pays for treatment. In public healthcare systems, like the NHS in the UK, the government funds patient care, meaning treatment is free at the point of use. In private healthcare, patients either pay for their treatment out of pocket or through private health insurance. Lots of doctors work in both sectors, offering flexibility in their careers. You might find that private practice offers higher pay, while public healthcare means that you can serve a larger and more diverse patient population. Some specialties, like neurosurgery, mean you have to work in a hospital, while others, like GP or pediatrics, give you the freedom to choose wherever you want to work. If you choose to work in a local practice, you tend to build long-term relationships with your patients as you see them more often. In a hospital, you tend to have a higher turnover of patients. The variety of placements I experienced at Southampton showed me that I prefer working in a hospital-based setting rather than a community-based setting like a GP surgery. Studying medicine doesn't mean you have to stay in a clinical role forever. There are lots of non-clinical career paths for doctors, like medical research, healthcare consulting, and pharmaceutical development. Some doctors go on to advise major companies on medical technologies, public health strategies, or healthcare management. Others work in medical education or policy, shaping the future of healthcare. Whoever you choose to work with and whichever setting you choose to work in, get as much varied experience as possible during your training to help you prepare and make your decisions.